Hello. Thanks for joining us today to learn more about expanded access for school-based health services. In this video, we will differentiate between the health services provided under an individualized education plan and those provided through expanded access services. We will identify services that qualify for billing under expanded access, explain the key requirements and documentation necessary for billing under expanded access, and where to locate additional resources for school-based health services. Schools are an ideal environment for delivering health services as they have hours of direct contact with children each day. School-based services improve access to care and reduce the burden on families, minimizing the need to take time off from work or school and alleviating transportation issues for appointments. The Kentucky Medicaid School-Based Health Service Program allows school districts to enroll as healthcare providers and to be reimbursed by Kentucky Medicaid. An Individualized Education Plan, or IEP, is established once a child has been identified as needing special education and related services. A plan is then established with the child's caregiver and school professionals to assist the child in excelling in the school environment. IEPs often include health services, which may be reimbursable if provided to a student enrolled in Kentucky Medicaid or the Kentucky Children's Health Insurance Program. Expanded access allows school districts to bill for health services provided to Medicaid or K-CHIP enrolled students beyond those included in IEPs. Expanded access helps more students receive crucial health services while providing a funding source to school districts. Both physical and behavioral health services may be covered by expanded access. An expanded access service is reimbursable by Kentucky Medicaid if the child has Medicaid or K-CHIP, the service is medically necessary, the service is a covered service provided by a qualified practitioner, the service is offered to all students at no cost to students, and the district has received a signed parental consent form. An example of a medically necessary service would be if a student falls on the playground and is taken to the nurse's office. The nurse provides an assessment and identifies the student has an injury requiring treatment. The assessment and treatments, if provided in the school setting, could be billed to Medicaid under expanded access. Another example is after hearing screenings are provided in a school, the audiologist determines additional testing is needed for a student. The additional testing is a Medicaid-covered service, and the audiologist could bill Medicaid for the service under expanded access. If the child subsequently needs an IEP due to hearing loss or an auditory processing disorder, the services included in the IEP would be billed to Medicaid under IEP services. There are a couple different billing models for school districts when billing Medicaid. The first model is when a school district hires staff and bills for their services. For example, the school district employs a speech pathologist for speech-language assessments, and the school district bills for the services provided by the speech pathologist. Another billing model is when a school contracts with providers and the school district bills for their services. For example, the school district contracts with, rather than employees, a behavioral health therapy group to provide crisis intervention when needed. The school district will bill for the services provided by the behavioral health therapy group. The behavioral health therapy group would not bill for the services. School districts may also contract with providers, and those providers bill for their services as usual. For example, the school district contracts with a dentist to come into schools to provide dental screenings and fluoride treatments, and the dentist bills for the services provided. The school district would not bill for those services. Parental consent is a safeguard that ensures privacy, legal compliance, informed participation, and ethical practice. The parental consent form is a legally required document to offer services. Parents have the option to deny access for billing. Should parents later wish to allow billing, a new consent form must be sent to the parent. A few things to keep in mind is consent forms are not retroactive and services performed must be after the signed consent date. Parental consent forms only need to be obtained once unless the child's custody arrangement changes. For example, if a child moves foster homes, a consent form must be obtained for each household. If the child leaves the district for any amount of time, a new consent form must be obtained. Best practice is to include parental consent forms in annual school registration packets. It's also recommended to have an electronic backup of all parental consents and have written policies and procedures regarding parental consent. To learn more about expanded access, you may consult the School-Based Health Services Technical Assistant Guide. If you would like more information or to attend additional trainings regarding expanded access or school-based health services, contact the Strengthening Health Integration in Education for Kentucky Students or SHINE Kentucky project team at shineky@ky.gov.